Also, I think we are live.
We are live, so we'll just hold on for a while. Yes, we are live. So, hi, good evening, everyone. So, I am Dr. Sushil, your faculty of orthopaedics at DBMCI, and your mentor at the FMG Center, this FMG segment of DBMCI. And these sessions that we have planned for you, the direct connect, these FMG shows, they are one of its kind of shows where we are going to make sure that you meet all the faculties of all these 19 subjects and break so many myths, which most of the FMG students have जब आप अपने college में हो, when you are abroad, and when you come back to India, most of the time it is too late to understand कि कुछ तो छूट गया, कुछ तो गड़बड़ हो गया, right? So, how to utilize your time? What is the contribution of all these 19 subjects? How we should be approaching them? Should I be studying them or not? So many questions we have. And today, for the first show, I have none other than Master of Radiology, Dr. Rajat Jain, sir. Hi, sir. Good evening.
Good evening, Dr. Sushil. How are you?
All good, boss. Thank you so much. And
Thank you
thank you
very much
so
for
much.
inviting me on this episode, and I'm very hopeful that the session will be of great use to the students who are confused that how to read, what to read, and how each and individual subject should be read. So I'm quite hopeful that it will be a wonderful experience for the students.
100% boss. And you said two questions: how to read, what to read. But this show is a little different, where I am going to ask you why to read. So that is the question most of the student ask. Sir, abhi I am in fourth year. Ab I have reached to fifth year. Ab I have reached to the final year. Ab I have to come back to India. But sir, ये ना subject A, B, C, and to be very specific, sir ये orthopedics वाला, radio वाला, anesthesia वाला, सर छोड़ दूं क्या? One liners हो जाएगा. Sir, please tell me. First of all, as a experienced faculty, you have been here in the industry for more than 15 years now. It's been too long, and you have seen the evolution of the examination pattern from that basic all India state level exam going up to the NEET, INI set, FMG going clinical. I would like to know from your experience that how do you see these exam pattern evolving?
So, boss, first of all, thank you for raising this particular question about leaving some of the subjects. And this is the fundamental difference that I have seen students studying for FMG screening exam versus the students studying for any other exam. That I do not know from where they have got this, that they can leave some subjects for the exam. The rule of any exam like this is very simple, that you have to be jack of all trades, because you can't be master of all. Right. So I will give you a very simple example to this. Let us say that we are talking about a big subject, let's say PSM, right? And let's say that out of 300 questions, let's say 30 questions will be asked from community medicine. And if I give these 30 questions to the students and tell them that take 15-20 days to read PSM, how many questions will they be able to solve if they have read it very well? The answer will be 20, 21, 22. If I will give them 2 months to read, then this accuracy level will go to 24, 25, right? On the other hand, if they will give 2, 3 days to radiology, there will be 10, 12 questions who's gonna be there, and the accuracy level will be close to 90, 95%. So out of 12, they will be able to solve 10 questions in the exam. So reading a bigger subject for 10 extra days is more beneficial, or reading a shorter subject for 2 days is more beneficial. It's a simple maths. I do not know that why students do not understand this very simple maths. The accuracy level of the short subject is very high, and your threshold of 150 out of 300 can be very easily achievable if you have read these subjects well. So that's in a very simple nutshell.
Boss, now you have opened a Pandora box. Now, this is something that you are saying that this, scoring in radio, ortho, anesthesia, psychiatry, derma, FM, biochem, micro, these are becoming more easier. These are easier to, learn the subject and score well in the subject. So that line actually should hit hard all our FMG students, and they should understand that, these subject making from 50, 60, 70 marks, these are something which are short. So thank you so much for this line you said. It is genuinely wonderful. Sir, I want to know very straightforward questions coming all from the students. Sir, I don't want to read radiology. I don't want to read it. Sir, how much do you think the radiology contributes to FMG exam?
Boss, I want to share my screen on this.
Please, sir, go ahead.
Is it visible? So
Now it is visible.
this is in brief about what is being asked from the exam. I believe that whichever exam that you are targeting, first you should know that what is being asked. So this is how the questions of the radiology are being asked in the paper. 1 and 2 questions are asked on identify the name of investigation. They will show you an image and they will ask you which investigation is this. 2 to 4 questions are asked on an image where the image will be given and the question will be what is the diagnosis of this image? Is it a pneumothorax? Is it a which fracture or something like a image and a diagnosis? One question in the exam is asked from a nuclear scan. They will give you a clinical scenario and they will ask you which nuclear scan is to be done. 1 or 2 questions are asked from radiotherapy. 2 questions are asked on preferred radiological investigation. They will give you a scenario and they will ask you that which radiological investigation is to be done. And 3 to 5 questions are nowadays asked where a history is given, an image is given, and you need not to look at the diagnosis, but on the basis of the diagnosis, you have to decide the management of the patient. So in a nutshell, if you ask me, I will say somewhere between 10 to 15 questions are going to be there in the exam. So that's easy 10 extra marks of the paper. So one should not leave this opportunity to grab these 9 or 10 marks in the exam, which can be acquired with a very ease, because this subject is not taught during undergraduation. So the things that are being asked in the exam are also focused on certain areas which are essential for a doctor to be known. That's all.
Now, sir, what you are just saying is that every student's mindset. Now, I have been traveling a lot and meeting all the FMG students across the, I can say, countries, even at our pan-India level. And there is one common mindset, sir. Radio makes only 4 or 5 questions. Ortho makes only 4 or 5 questions. Anesthesia makes some 2 or 3 questions like that. So now what you are saying is, it is not the radio or ortho which makes 4 or 5 questions. It is actually more than 10 questions. Because if you read any of the particular subject like medicine or surgery or OBGY or orthopedics, then you're reading a topic and then you're going to the investigation. But when they attend radio class, when they learn radio from you, that means they're directly going to that question, isn't it? Making it more simpler for them. So that's another wonderful thing about the subject that we can learn very quickly.
Yeah.
Sir, now, like you said, it is a
Shall I add a
straightforward.
point to here what you're saying about the number of questions that are there?
Please.
I want student to comment on this. Those who are solving MCQs, how many of time you face this particular problem that you see a question, you come across, Array, I have read this particular topic, you see the options, you get confused between the 2 options, and eventually you are not able to pick up the right answer. And then you blame it on your luck that, oh my God, my luck is bad, and as a result of which I could not pick up the answer. And most of the time, it is because your integrated knowledge of that subject is not strong. And when you call integration, one of the fundamental subject in integration is clinical questions, which is based out of radiology, right? So a lot of time you get a question, which investigation, if I ask question that tell me which is a preferred investigation in a patient with fetal growth restriction, a student will immediately comment Doppler or ultrasound, right? What is the ultrasound? What is Doppler? This is radiology. So if your fundamentals of the radiology are clear, you can solve the questions of medicine with ease. You can solve the question of surgery with ease. You can solve the question of OBG with ease. You can solve the question of any clinical subject. You can solve with ease. And in a joking way, I always say this, almost every clinical subject becomes slightly easy for you if your radiology knowledge is strong, except one subject. What is that subject? You have to write it. Tell me in the comment section, which is that subject that doesn't become relatively easy with sound knowledge of radiology. Comment लिखो भाई बच्चों.
They are writing, Abhi. They are, okay, they will get on to it.
That's
But
an that's
wonderfully said,
okay. I am giving you a hint. That's an irony of my life.
sir.
सुशील बहुत समझ गए हैं.
Let's see, sir, if somebody can comment. PSM, psychiatry,
Psychiatry
medicine.
becomes easy, bachche, because psychiatry you have to rule out lot of organic disorders,
Yes.
right?
Medicine, PSM.
And medicine is completely dependent on radiology. Tell me any patient who is being treated in medicine without radiological investigation. There is only one subject where people treat without radiological investigation: dermatology. And why that's an irony of my life?
No comments. No comments.
Yeah, because I'm married to a dermatologist. So that's probably an only branch where she doesn't ask for my help. Otherwise, at most of the places, you come across where we make a combined diagnosis and we reach to an answer. So, and we reach to the correct patient's management. Boss, over to you.
So, sir rightly said, I was taking a class day before yesterday, and in my class, I just asked, what is the investigation of choice for avascular necrosis? Right. So I gave the clue to the student that it is related to the vessel supply, blood supply, and the answer I got was color Doppler. So I said, see, you have to understand the difference between a color Doppler and a MRI and how they, like, are different investigations and what they work and how they show you the differences. So definitely the basic sound knowledge is required. Now, having said this, sir, are you trying to say that radiology is more of a factual one or there are concepts also?
So, boss, देखिए, in every subject in medical field, there are facts. But you have to understand you cannot memorize facts without knowing an underlying concept behind it, right? So the rule is very, very simple. If you will try to mug up something, you will forget it. Again, this is a question for all the students who are watching this. Just ask yourself, how many of you face this particular problem that you have read something and after 1.5 months you say, sir, पढ़ा तो था मगर भूल गए. ये तभी होता है when you have tried to memorize it. But the day you try to understand it, you don't forget. More you're gonna try to memorize it, more is likely you are gonna forget it. So every subject is a combination of concept plus facts. So what you need to do is understand those concepts pretty well. It will be very easy for you to memorize the facts also, right? Every subject is a combination of the two. If you think that it is a purely factual subject, you are hardly mistaken. I'll give you an example. Um, um, you all have seen an X-ray in the life, right? You all are memorizing ये pneumothorax है, ये pleural effusion है. Boss, I'll tell you a very interesting aspect. I was taking a class in years back, 6-7 years back. Students came to me in the break, and we were discussing about pleural effusion, pneumothorax, and they told me, "Ki sir, this is the first time we have understood why this is pneumothorax, why it is pleural effusion. Otherwise, in our MBBS, our seniors have told that this X-ray which is cut from the top right corner will be pneumothorax."
Like same like histology slides.
तो वी यूज टू सर्च कि अच्छा ऊपर राइट पे कटा है तो न्यूमोथोरैक्स है, अच्छा नीचे से साइड में से फटा है तो प्लूरल इफ्यूजन है. ऐसे नहीं, ये नहीं
Pleural
करना.
effusion.
अगर ब्लैक है तो एयर होगी, राइट? एयर विल ऑलवेज बी ब्लैक ऑन द एक्सरे, राइट? तो अगर वो ब्लैक दिख रहा है तो ही न्यूमोथोरैक्स हो सकता है. इफ इट इज वाइट, इट कैनॉट बी न्यूमोथोरैक्स, राइट? सो दैट इज हाउ you understand a concept behind why it is looking like this.
Absolutely. I do agree, sir. Like Maitri is saying, आप कह रहे हो 1 महीने में भूल जाओगे, she is forgetting in 1 week only. So
वन
this is
वीक
bound to happen,
बॉस,
beta.
लैंसेट का आर्टिकल है. लैंसेट का आर्टिकल कहता है कि आपने आज जो भी बात करी, जो भी काम किया, आपको उसका 20 to 30% ही याद रहेगा अगले दिन तक. तो
Sir,
वो तो
listening to
सब भूले,
you,
अगले दिन की बात कर रहा हूं मैं. बट पॉइंट क्या है? 20% याद रहने वाला है. बट वो 20% कौन सा याद रहने वाला है? जो आपने समझने की कोशिश की.
absolutely. The concept-based reading we have. Now, sir, I am getting convinced somehow that I should read radiology. I am not saying कि अब मैं छोड़ के जाऊंगा एग्जाम में, but sir, tell me, I am convinced, not very convinced. सर पूरी वाली वीडियो देखो, आपके रिवीजन वीडियोस देख के काम चल जाएगा. I have not read radiology yet. पढ़ा नहीं है मैंने कुछ. So should I see complete videos or rapid revision videos?
तो बॉस, आपने ना बहुत ही टची बात बोल दी. कंप्लीट वीडियो क्या है, पहले तो इसको समझ लेते हैं. किसी भी सब्जेक्ट को पढ़ने का बेस्ट तरीका क्या है? उस सब्जेक्ट की टेक्स्ट बुक पढ़ना. वो बेस्ट तरीका है किसी भी सब्जेक्ट को पढ़ने का. बट अगर वो पढ़नी थी तो फर्स्ट ईयर एमबीबीएस से पढ़ाई शुरू करनी थी, करेक्ट? तो ये वीडियोस क्या है? these videos are amalgamation of important areas which are likely to be asked in the exam, which have been made simplified for the students. It is our, like for me, I mean, boss, it's my 19th year of teaching now. So it's my experience of 19 years, which I have amalgamated and put it into 15-16 hours, right? That these are likely to be asked in the exam, right? अब आप इससे जितना शॉर्टकट लेने की कोशिश करोगे, the likely of success will keep on decreasing, right? अगर आप 15-16 घंटे रेडियोलॉजी पढ़ रहे हो, तो इससे क्या होगा? आपका 90% अंडरस्टैंडिंग सॉर्ट हो जाएगी, 90% क्वेश्चंस उसमें से एग्जाम में आ जाएंगे, राइट? अब मैं इसको कट करके 4 घंटे कर देता हूं। अगर मैंने इसको 4 घंटे किया, तो अब इससे क्या होगा? जो 90% है, इसमें से कॉन्सेप्ट हट जाएगा, फैक्ट बचेगा, नंबर 1। एंड सेकेंड, वो जो 90% था वो 60% हो जाएगा, 70% हो जाएगा, राइट? बट वो जो 2 और 3 क्वेश्चंस है, वही आपको कहां पर लटका देंगे? 150 की जगह 147 पर, 144 पर लटक जाएगा, राइट? तो इफ you have read the subject pretty well, then the revision video work. Whenever you are reading the subject for the first time, if you are doing it during your MBBS, read it from the textbook. If you have 6-7 months to prepare, then read it from the main videos. Once you have completed the main videos, during the revision time, when the exam is 1.5 month away, 2 months away, then do it with the revision videos or shortcuts. That's the very simple philosophy.
Okay. Sir, when you say that, if by chance there are two set of students, sir, we have right now, the students who are going to go for the June-July exam right now, 25. So July may be like first week or second of July is the tentative date for the exam, and another set of students who are ready to come back to India and will be appearing for exam in December. Now, having like what you just said, if you have read radiology completely, it is going to help you out definitely a lot. And this line is the gold, I can say the gold standard line, which should be, known and understanding by all our students. कि ये एक क्वेश्चन दो क्वेश्चन जो आप छोड़ के जाते हो ना, the whatever you are leaving, you never know that this is that one question which might unfortunately will have that 149 mark or 148 mark. It is not a good idea. So read completely. But sir, in the June exam now we are already into the month of April. And abhi bhi I am reading my own schedule. I'm not connected to any institute. I'm reading by some app, but radio nahi padha hai, sir. So now should I directly go to rapid revision? That is what you are saying?
No. So boss, it completely depends. If you are starting now and you have only 2 months and you have to complete all 19 subjects, then you don't have an option but to go for rapid revision. But let us say you are studying, you have already completed your 10, 12, 13 subjects, then you should definitely go with the complete videos.
Perfect. Wonderful, sir. Now tell me, sir, if I have not read and I want to go for the rapid revision video, should I go for the NEET PG one-shot videos? Will they be enough? Because I know you have done one shot in some 3-4 hours, the radio was complete. So
Yeah.
will that be enough? And is that word enough actually a correct word to be used?
Boss, there is nothing called as enough. That is what I will say, right? But as I told you already, everything is dependent on the total amount of time that you have, right? If you have, like, we are sitting at 15th April, 14th April, right? And let's say our exam is towards the end of the June. So we have 2 months. And somebody tells me that I have to complete all the 19 subjects in these 2 months. I say, you don't have an option. You can't give more than 4 hours to radiology, right? I'll tell you, in a NEET PG, I made a schedule for a revision for 75 days, right? So in a 75 days, we made a schedule for the student that you have to revise it twice. So we made a 45 days, then the INI-CT exam, 7 days for the re-revision, and then another schedule for 20-25 days. So in a 45 days, I gave 2 days to PSM. One of the student wrote a comment, sir, how can you complete PSM in 2 days? Right? I told him, कि बच्चे, who told you to start these studies now? I am at the top of my voice is telling you for the last 1 year, start studying, right? But now you are starting at 2 months, 2.5 months before the exam. You don't have an option but to go with this particular part. It will help you to cover major things, not everything, But will there be a difference from the student who has read the complete videos versus a student who has read the one shot? Yes, there will be a difference. Because if there is no difference, I am not a stupid person that I have recorded 16 hours.
Yes, absolutely.
So there will be a difference. But if you have to read 19 subject and you want to have a sense of completion, you have to do it with a shorter version. But yes, somebody is preparing for the December exam. He comes and say, sir, I want to do it from one shot. Shall I do it from one shot? My answer is no. My answer is please do it from the complete videos or complete class, preferably complete class also.
Uh, I do agree, sir. And with your answers, I'm gradually getting convinced that I have to read radiology or any of the subject per se. But when it comes to radiology, sir, in my college, radiology is not done. I am into country A and into college B, but in my college, the concept of radiology is not there, and I'm solely dependent upon a particular app. Now I'm looking at your videos. I am trying to understand it. I can recall some, I forget most of it. So please tell me some of the most important topics which you think in radiology are important.
So boss, again, I'll share my screen for this.
Please.
So these are some of the very, very I hope my screen is visible. These are
Not
some
now,
of
sir.
the
Now it is.
some of the very, very standard topics that are asked in the exam. 1, 2, 3 questions are definitely there from the chest from the chest X-ray in the exam. Images of IVP, barium is a standard part of our paper. I have almost never seen a paper in FMG screening when one image of the barium is not there in the paper, right? Image of the PET scan. Nowadays, there is an increasing trend of asking the question on the PET scan. ERCP, MRCP images, MCU, RGU, HSG images. HSG are often incorporated or integrated with your OBG as well. Question on radio sensitivity. Then there are some standard topic like shape of vertebrae X-ray based, shape of heart X-ray based, shape of skull. Then head trauma. You will get one question on the head trauma in the exam. Stroke, images of paranasal sinus X-rays. Topics like aortic dissection, pulmonary embolism, pulmonary edema, pneumoperitoneum, intestinal obstruction, intussusception, abdominal trauma, ankylosing spondylitis, and pregnancy ultrasound. Right? These are standard set of topics that you're gonna see are forming the lot of chunk of your paper.
Sir, the list that you have just shown, now it reminds me of your very first line that, it is not only a subject of 4, 5 questions. It is a subject which is incorporated with all your other medical clinical subjects, right? So question is coming from everywhere, from surgery, from OBGY, from orthopedics, from medicine side. And in medicine, it is everywhere, respiratory, CNS, CVS. So definitely that makes a big one. Uh, so now one very important thing. Sir, again, sir, I am getting convinced till whenever I'm just looking at your show, I'll be okay. Sir, padna hai radio. But sir, nahi ho pa raha hai. So, what is your take on if I go to the exam with the NEET PYTs, with the FMG PYTs, and with INSA PYTs? Sir, should I focus only on FMG PYTs or NEET or INI also?
So, boss, for the radiology specifically, that I'm gonna say that the people who are making the paper are broadly same nowadays. And rather, I have seen lot of questions which are asked in FMG for the first time, which are repeated in the NEET PG. Like, for example, the first time the question of a PET scan image was given and the question was identify the scan was shown in the FMG screening exam, and 2 years later, it was repeated in FMG, right? In this year January exam, they asked PSMA PET. They have never asked PSMA PET even in NEET PG till now. And I am very, very sure that in the future exam in the NEET PG, you will see a question on PSMA PET, which is done for prostate cancer metastasis. Right. So, apart from some extremely complicated topics of MRI, I will say that majority of the areas have become nearly same. One of the fundamental change that has happened in the FMG screening exam, which students need to understand, is the exam has shifted from one-liner to more about a clinical approach. The examiner is nowadays trying to see whether you are safe for the patient or not. Examiner is trying to see that if you are asked to sit in the emergency, are you life-threatening for the patient, or can you save the life of the patient or not? And that is why questions on pulmonary edema, question on management of MI, question on management of pulmonary embolism, question on acute trauma. These have taken a center stage in today's time.
Sir, now with your these talks, with your these words, I'm getting more and more convinced. And now I have a very straightforward question, sir. I'm using app A. I'm into college B. Sir, I have this app which is like, having the recording like any other app, but समझ में आ रहा है थोड़ा नहीं आ रहा है. Will it be helpful if I take the workbook of your classes that you have taken at DBMC FMG? You already had a class and it has been a wonderful one. So should I take that workbook from some of the colleague at Delhi? And will that be useful for me?
Um, Boss, every person might have a different opinion on this, but my opinion is the workbook is useful along with the class only. Because once you have attended the class, then you fill the workbook. Uh, in workbook, there are lines that are written. The concept you understand in the class and you write it down. The workbook are being created so that it becomes easy for you to revise the subject towards the end, right? You took 15-hour class of radiology. Now you have created the workbook, you have filled the workbook. Now you want to revise the subject from the workbook, you can do that in 4 hours. In comparison, you are taking a shortcut and the shortcut is being done in 4 hours. Now you have already attended that class. That complete class can be revised in 4 hours with that workbook. So basically, now you are targeting 90% accuracy in comparison to the 60% accuracy that you would have done with a shortcut. That's how I will take it. So take the workbook, attend the class, don't take pre-filled workbook, fill it yourself, try to understand the concept that a teacher is telling you, try to see that they are telling you. I always give a very simple example, and since the great orthopedic surgeon is with me, let's combine it and let's talk about this. I always say that हम fractures की बात करते हैं, right? So now ultimately, boss, you also need a radiograph finally to see the type of fracture and decide the management of that. We all know that majority of the fractures we know are the break in the continuity of the cortex, right? Now the concept says that if you want to see cortex of the bone, you need to do an X-ray based investigation. Now we have got two X-ray based investigation. We have a radiograph and we have a CT scan. So both can show you the fractures pretty well. But now the question is there that which fracture will be seen by radiograph or which fracture will be seen by a CT. So how we going to decide that what is to be done, right? So now we're going to make up, there is two options. One option is I'm memorizing it. I am memorizing that, okay, this fracture will be done on X-ray, this is done on this X-ray, this is done on this X-ray, no, this is on CT, this is on this CT. And now the second concept I can simply make is if a bone has got two parallel cortex, its fracture can be easily seen on X-ray. However, if a bone has got a complex anatomy, the break in the continuity will not be very well seen on X-ray. For that, I need to do a CT. Now I have understood a concept. Now I will be able to answer any question. Somebody asked me humeral fracture. I say, okay, humerus has got two parallel cortex, simple anatomy. I can diagnose it on X-ray. Clavicle fracture, I can diagnose it on X-ray. Tibia fracture, I can diagnose it on X-ray. Somebody asked you vertebral fracture. And then you say, okay, vertebra has got a complex anatomy. The fracture of the vertebra will be better seen on CT. Somebody asked you facial bone. You say, a facial bone has a complex anatomy. It will be better seen on a CT. Somebody asked you calcaneal fracture. You say, calcaneal X-ray पे दिख तो सकता है, but confirmation of a calcaneal fracture will ideally be done on a CT scan because it got a complex anatomy, right? So this is the fundamentals that you learn. You have understood this in the class. You have written it in one line: simple anatomy, radiography, complex anatomy, CT scan. Now, if somebody else is reading this booklet, they will never be able to understand what is being written. But if you have read it in the class, you will be able to recall it far, far better.
This is just a wonderful example you have given. And I must tell all the students, देखो इतनी छोटी सी बात है. And on the other side, I have seen people making a whole page note: humerus, tibia, femur, fibula, all of them X-rays, and then carpal bones, this, that, scaphoid, lunate, and all that going by the CT scan. Now see, once you learn one single line, and that only comes to you when you are sitting in the class in front of faculty, and it is not only a class. There you have like-minded people, and they all have some doubts, and cumulatively so many doubts they give you so much of insight about a subject. वो अकेले बैठ के अकेले रूम में बैठ के ऐप से पढ़ के, I'm not saying apps are bad, but this should be the resort when you don't have access to anything else, right? So at Delhi, how we do it, I'll just tell you. When Rajat sir is taking a radiology class, the same class always gets relayed to your mobile devices. Wherever you are in India or at your college, the same class at the same time is being relayed at your mobile devices. You can stay connected with sir through the telegram, through the in-app notification, and you can ask him the doubt. That, sir, this is the problem. This is I'm not able to understand, and he's more than happy to explain you again. So it is a virtual thing where you are still connected to him, sitting in some other country, right? If the college timing doesn't suit the class timing, then if the class, once the class is done, the same recording is available onto your mobile devices as well. Now, this platform is what we call as DBMCI Live, which we are gradually shifting onto the DBMCI One app. So this is a transformation phase for the app, but that app is making you connected, stay connected with all the faculties, right? So that is a wonderful example, sir. And sir, one thing now, when you are saying that these are the simple concepts, please tell me while making, like you have said so much now about the subject, that should I read radiology? Like I said, sir, I don't want to read radiology, but you convinced me to read radio. Now, sir, when I'm reading a subject, let's say radio or any other subject, now it's a general question. With your experience of such huge, long duration of teaching, now what you have observed the most, the students making mistake while preparing for a particular subject. What is the commonest mistake you've seen?
Was the commonest mistake, I think we have already spoken a lot about it, that they feel that they will memorize it. Whenever they are reading the subject for the first time, they should not even think about memorizing it. They should spend time in understanding the subject. The first reading is never to memorize. The first reading is to make yourself familiarize with the subject, to understand that how it is making a difference in patient's life, how it is helpful for patients. Your predominant aim is to identify that how these in terms of radiology, how these investigation work. If we are seeing something as black, why we are seeing something as black, what are the causes of these black, is the aspect of revision. But right now we need to understand, if I am saying that this area is hypoechoic, why this is hypoechoic, what is the terminology as hypodense, what is the terminology as hot spot, what is the terminology as cold spot, right? What are the causes of them is a term that I'm going to memorize later. So in the first, most of the students feel that they will memorize it, and they memorize it, they try to, okay, I have remembered it. And they, in the evening, they're very hardworking. They have solved the question. They are able to solve some questions also. But after 10 days, it's completely gone. So
Absolutely.
that's an area that I feel is very common. The second is that people do not understand what we call as a Pareto's theory, and that is that there are certain areas which are more likely to be asked in the exam. There are certain areas which are less likely to be asked in the exam. So my first effort should go to those areas which are more likely to be asked in the exam. My later effort should go to those areas which are less likely to be asked in the exam. And a teacher who has years of experience, who is sincere, who consider this not just as a passion but a profession also, is aware of this particular fact, that what are the things which are more likely to be asked in the exam. So trust on them rather than to go into what is called as fear of missing out.
The FOMO, right? And this term we learned in the COVID period, sir. I remember that COVID period was a very unfortunate time, but this is something which we started learning when students started sharing all these concepts. Sir, now you're not traveling, we will miss out these things and those. So that is a term that came, I guess, that time in the COVID period. Wonderfully explained, sir. Now, sir, if I am in my college, I'm in third year, fourth year, final year. I'm still going to my college. My college hours are broadly 9 a.m., 3:30, 4 o'clock. How many days or how much time, like your app has, let's say, for example, 20 hours. Sir, I'll not be able to give 20 hours at a stretch. How many days, how much time actually I should devote to understand the subject? So will it be like 20 to 20 only, or I can take some more time or less time, or should be quick with that?
Because there is a difference. If you are reading from a recorded lecture, your speed is always slow. If you are attending a live class, the duration will be equal to the live class lecture. If it's a 4-hour class, it's a 4-hour. But if the 4-hour recording is to be read, you will take at least consider twice the time. 4-hour recording will be done in 8 hours. Right? That's how the standard, and this is for a student who is dedicated. The student who is not dedicated, this 4-hour could be 4 months. But usually a dedicated student who is focused is 4 hour will be completed in 8 hours. आपका फोन भी आएगा बीच में, आप इंस्टा भी स्क्रॉल करोगे बीच में, आपका व्हाट्सएप भी चल रहा होगा. All these are part and parcel in a recorded lecture that is happening, and that is why which resource you're gonna choose is completely dependent on the level of discipline that you have from within. And nobody else can tell you that. You are the one who's going to decide that the kind of discipline that you have, right? So that discipline is going to decide. And I will say that if you are a third year MBBS student, if you can complete 2 to 3 hour lectures in a day, that is sufficient. That is sufficient. After the lecture all, if you can complete 2-3 hours, this is, you are already at a different level.
Sir, one very common question which I keep on getting from so many students. Sir, I have read from source A. Now I have seen your YouTube videos. I have talked to my colleagues who are studying at Delhi FMG, DBMCI, and I came to know that they have understood radio better. They have understood subject B better. But I am little hesitant to change my source. Should I change my source or no? What do you say?
2-3 points I am gonna raise onto this, right? First of all, remember this: you are walking on a road, and after walking for, let's say, a kilometer, it's a 10-kilometer journey. After walking for a kilometer, you realize that you are traveling on a wrong road. Most tell me, what will you do? You will
I'll
keep on
stop. I'll
walking on the
change my
same
source.
road. I have started walking on this road. I have to keep on walking on the same road.
But how to decide it is a wrong route? That is
I'll
the
come
question.
to this. I'll come to this. But first, tell me, you have realized that you are
You
on a
need to
wrong road.
stop. I think I am not being able to be on this road. I'm not getting what I was expecting. So probably yes, I'm on the wrong road. So I'll stop. I'll
And then
think
you will have
what
to
needs to
change
be
it,
done.
right? So
Absolutely.
that means once you have realized this, that you are on a wrong road, there is no harm in changing it. Rather, you should change it without a doubt. But you have asked a very, very valid question. How do you know that it's a wrong road? How do you know? So first of all, please remember, who is teaching you is less important. Who is reading is more important, right? I am saying with a lot of proud that it's my 19th year of teaching. Does not mean that I'm the only person who is teaching for 19 years, number one. And that does not mean that somebody who has an experience of 10 years does not know how to teach. Sometime, some teacher make it slightly more simplified. Some are unable to do that. And as Shah Rukh Khan always say, I am the best. So I always say that I am the best in my field. There is no doubt about it, right? But that does not mean that you read it from somebody else that has not done the justice with the subject. You will decide it for yourself. If you are able to solve MCQs, if the MCQs are given in your notes, that means you have to read those notes again. However, in spite of reading it, you are not able to solve your MCQs, you are unable to understand it, then change it and then come. That's what I will say.
Wonderful, sir. So I think broadly I have taken all the questions which came from student to summarize what you all said. Do correct me if I'm wrong somewhere. So can I leave a subject or let's say radiology? Answer is simply no. Should I go for main videos or rapid revision? Depends upon your time. If you have time, go for main videos, understand concept, and then only go for rapid revision videos. How many questions do they make? It hardly matters because it is an integrated subject. So even a wrong one question at 149 is going to make a difference. So don't think about the question, think about the subject. Can I read and change the source? 100%. If you're not satisfied with what you have, change it because ultimately it is your result, not mine or not somebody else's. It is your thing and it is going to hamper your things only. Right. So come onto the right track as soon as possible. Can I study at my own place if I'm not in India? Yes. You have your own apps. That is one. We have is DBMCI Live or DBMCI One platform, which helps you to take the classes at the comfort of your hostel, at your country, at your college, wherever you are, at your time. Same parallel classes going on at the Delhi Center. And how we do at Delhi Center is after the class is done, Rajat sir himself is going to select the question paper for you. And that post class test you have to give, and then you assess that where you stand after understanding the subject. Now, post-class test, once it is done, we are going to have the post-class test discussion also, right? And like this, we complete all the 19 subjects. This is called as round one. Every subject followed by post-class test and the class discussion. This is round one, and this round one at Delhi FMG we are going to complete by 20th of May. So after the May 20th, we are going to have round two of a revision plan of all the 19 subjects. And before your exam, we are going to have a round three as well, where we are going to focus upon your computer-based test, your grant test, your cumulatives, and so on to make sure there is nothing left, including your PYTs of the NEET, INSET, and the FMGs, right? So this is how we have planned it daily. And those students who have put a message here in the chat section about the revision strategies, the schedule, and all. So my team has shared a Google form with you. If you want to be in connect with me at Delhi Center, me along with Dr. Sakshi Arora Hans ma'am, we are here at Delhi FMG, right? And we are very well connected, I do believe, by the Triple S group, by the DBMCI FMG Telegram group. So if you have any query about these things, please drop a message or fill this Google form. Sir, the last and the very important question, with your experience, your message to all the students who are going to appear for the June exam first and those who are coming back to India and will be giving the December exam. So, what all you, us, we as a team to offer to all the students?
Boss, I have only one point to say, and that is please become disciplined if you are not. If you are disciplined, please stay consistent. Very rarely I have seen students who remain disciplined and consistent are not able to achieve what they want to achieve in the life. Whatever that I am able to achieve in my life is only because of the consistent effort towards that particular point that I wanted to achieve. So remain consistent. A lot of time you have it from within. Sometime you need a support. If you have from within, that is the best thing that can happen. But if you want a support, we will try our level best to provide you that guide, to provide you that support so that you can achieve the dream that you're looking for, because our success is based on whether you are able to achieve your dream or not in the life. So if you think that you need any support from us in any form, try to give us a chance, and I can assure you that we will not disappoint you and we will celebrate your success together.
Wonderful, sister. Uh, Thank you so much, boss, for all these important points. And I'm very sure your examples, the lines you have used, the words that you have used, they are going to strike very hard in the minds of all our students. And it is going to make a difference in their thought process. कि subject छोड़ देते हैं, one liner को रट लेते हैं, वही सब चीजें आएंगी. It is definitely going to make a change. Thank you so much, boss. And
Thank you, boss,
thank you
and thanks
so
for
much.
making me a part of it.
Thank you so much. And thank you so much, everyone, for being here. Fill the Google form if you want to get connected with us. And if there is any another thing, wherever you are, just know this thing that if you are a part of DBMC FMG, if you're a part or no, it doesn't really matter. We are going to be there with you all the time. You can reach out to us without any hesitation, without any second thought. We will be there to help you out till you qualify not only this FMG exam, but to get a seat in the or secure the seat in the NEET or the INSET exam as well. So keep studying, stay disciplined, stay consistent, and I'll see you again with one more faculty telling you the importance of the other subject very soon. Stay tuned. Thank you so much, everyone.